Hello, good day. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. How are you? Today's clinic is going to be straightforward. Today, it's going to be focused on miscarriage, stillbirth, and pregnancy loss. Unfortunately, so many of our members have experienced this very painful, episode. Probably 2022, you had a couple of miscarriages, and probably you had a stillbirth. You need to know the difference between stillbirth and miscarriage. 20 weeks. So if you've had this experience and you're not in a good place and you're wondering if you're going to be a mother again, the answer is yes. However, there are some steps you must take to make sure you don't have repeat episode if it's something we can prevent. So that's going to be our topic today. Taking basic steps when you've had miscarriage or stillbirth or generally pregnancy loss, things you have to observe before becoming pregnant again to increase your chances. So please, once you join, let's know who you are. So tell me your name, tell me where you're located. Then as soon as possible, I'm going to start the clinic. It's going to run for 30 minutes. So the first part of the clinic is going to be my presentation. Afterwards, you're going to ask your question. If you have not subscribed to this channel, please make sure you do so. So go to the central page, click on subscription, check your notifications so that anytime I come live, you will be notified and you can participate in real time. You can also share this channel with your friends. There are so many beautiful videos out there that will help you to know your body better. The overall aim of my channel is to use education to help you to understand your health better, especially as it relates to fertility health. So if you're having problems starting your family, having your boys, your girls, your twins, your triplets, your quadruplets, you are in the right place. If you follow this channel diligently, you will end up becoming a parent. So let's talk. Unfortunately, pregnancy loss is very common, sadly. About 8 to 20% of known pregnancies, unfortunately, will end in miscarriage or stillbirth. Like I defined, miscarriage or abortion, it's the unintended loss of your pregnancy before 20 weeks. If it happens beyond 20 weeks, it's called stillbirth. They are both the same. It's very, very painful. Now, unfortunately, it's common. The 8 to 20% we reported is actually underreported because some women might not even know they were pregnant and they can miscarry their baby without even knowing. So the numbers we are quoting, it's more like, a conservative number. Now, it's a very painful experience. It will cost you a lot of pain. Matter of fact, if those couples are not careful, it can break a very loving relationship. So you and your partner must go through this together. It's okay to go through the motions of guilt, anxiety, blaming people, blaming yourself. Some people will also go through depression. But at the end of the day, when you are fully recovered, you can bounce back, you can become pregnant again, you can have all your babies okay. Don't rush to get back into becoming pregnant again. Give yourself time. Recovery is very important. So typically, there are a couple of things I will recommend immediately. There are things you should never do once you've had unfortunate end of your pregnancy. Number one, sex. It's not recommended for the first 2 weeks. So it's completely a no-no. When a woman miscarries, when a woman has stillbirth, there are so many things going on in the womb. There are so many things going on in the reproductive system. So that's not the right time for lovemaking. That's not the right time for sex because she's pretty much prone to picking up a lot of infections, a lot of problems, a lot of complications. So typically, the first 2 weeks, it's completely a no-no. So if you didn't know this before now, please make sure you share it with your partner. We do not recommend lovemaking within the first 2 weeks. after miscarriage, after stillbirth. That's 14 days. Now, listen to me carefully. You can actually ovulate and become pregnant as soon as about that 2 weeks, but it's not recommended. The reason is because if the reason why you had that miscarriage or stillbirth is because of things we can correct, we need to know why. So you have to work with your provider, number one. Okay. Now, acutely, when you've had this miscarriage, so most miscarriages or stillbirth will present with bleeding, with water escaping your vagina, with pain. These are the commoner presentation, but unfortunately, some women will experience miscarriage, stillbirth without experiencing this. So if before 20 weeks, probably you went for your normal checks and somehow you didn't bleed, you didn't have pain, blood didn't come out from your body, but there is no activity inside your womb, that condition is called missed abortion. So some people can actually have abortion, but it's a silent type of abortion. But generally, we need to be very careful. Don't jump into conclusion. Number one, you must call your doctor immediately. As you're calling your doctor, you're going to the hospital for examination. Miscarriage must be clinically confirmed. What's the best way to confirm miscarriage clinically? We have to run an ultrasound. So we have to take a look into the womb. So we have to run an ultrasound. When we are running ultrasound, we're trying to look at the womb to see if we have any evidence that the miscarriage is ongoing. Now, if it's confirmed you've miscarried, at that point of confirmation of miscarriage, what we will be aiming for is what we call total or complete miscarriage. We don't want incomplete miscarriage. Incomplete miscarriage can be deadly. Anytime your baby is no longer viable, we want to move all the contents of the baby outside the body. So some women can expel it by themselves. Some women we might give some drugs, and some women will go for evacuation. We need to make sure that everything about your baby, which definitely should have made you happy, it's completely removed from your body. When you have what we call retained product of conception, it might cause a lot of problems because the remnants of your baby inside your body can cause infection, can cause inflammation, can cause a lot of things in the future. So this is one of the most important things you have to do. You have to report to your doctor. We have to observe, we have to examine, we have to manage you conservatively. Some women might be blessed, they will just expel the whole contents by themselves. Some will give drugs, or some will go for evacuation. It's very important. Now, once you feel emotionally, physically, psychologically strong after a pregnancy loss, then at that time we can begin the conversation on what you can do again. Now, your recovery is not an isolated episode. Your recovery will involve both you, your partner, and the providers. Very important. I'm gonna go bring in the trash. Don't worry, I'll bring it up. So it's important you work with your provider because your recovery will now tell us when we can tell you, okay, you know what, you can go again. So after one miscarriage or stillbirth, it's important you understand that you can always become pregnant and have your baby. However, if we've had consecutive 3 miscarriages up, at that time we begin to be so worried because at that time it's called recurrent miscarriages. We need to know what's going on. So are there some tests we can use to attempt in knowing what could have gone wrong? Yes, there are some specific investigations we have to look at. We have to collect your blood. So we use your blood sample to evaluate to see if there is any problem we can detect. It can be bloodborne infection. It can be a couple of other things that might give us a signal from the blood. So number one test we have to run when you've had this, when you're in the hospital, we collect your blood sample. We collect your urine sample. Then we also check for chromosomal problems. So majority of the miscarriages and stillbirth are actually caused by chromosomal problems. Chromosomal problems means when the two parents were exchanging the chromosomes, the basic unit of life, the father will bring 23, the mother will bring 23, both of them will combine for 46. In cause of this, sometimes there might be error. Our body wants the best. So anywhere we have any abnormality, the body will reject the baby. So we need to check for that chromosomal abnormality. So you and your partner will collect your blood. to determine if it's a chromosomal factors. And we also collect tissues from the evacuation. So all the tissues of the baby out of the body, we're going to collect them and send them to the lab to see if we can notice anything that might have gone wrong. Now, there are also some other investigations we can run, like ultrasound. I've already mentioned we run an ultrasound to look inside your womb to see what's going on. Maybe you might have fibroids, polyp, endometriosis, or whatever it is, which might have contributed. So a big fibroid can actually contribute to miscarriage. So whatever is going on inside your womb, we need to confirm and see what's going on. Now, some women might also go for hysteroscope. So hysteroscope means we put a lighted instrument through the vagina to take a good look inside your womb. Now, some women will also recommend them to go for hysterosalpingogram. Though hysterosalpingogram is mainly used to know the state of your tubes, but in some situations, we might warrant to go for this. Now, some women might also be subjected to go for what we call sonohysterograph. This is also a special ultrasound where we use saline solution and we pass it through your womb to take an extensive look at your womb. Now, some other women might also go for MRI, magnetic resonance imaging. So these are the basic tests we can run to see where you stand. It's recommended that you work with your provider. You are not gonna do all the tests. The test you will do will be based on your individual situation. So it's not all women that will do MRI, sonohysterogram, HSG, and all that. Your test will be based on your own presentation. If luckily, after the miscarriage, you've stopped bleeding, there is no remnants of your baby inside your body, you're going okay with your psychological recovery, you're going okay with your emotional recovery, then we're going to monitor you. And of course, you abstain from lovemaking for 2 weeks. This particular instruction is very important because we want all subsequent babies to be okay. The babies you will have when you've had miscarriage or stillbirth, they are called rainbow babies. That's the babies that will come subsequently. Avoid bad company. There are some people that might be coming around and you might think they're doing you a favor. They're not helping you. Anybody that comes and says, oh, don't worry, don't cry about it, God is going to replace. That's not true. No baby can replace the other baby. The baby you miscarried, the pregnancy you lost, they live in your heart forever. The subsequent babies are individual babies. They are not coming to replace any baby. So you need to understand this. Now, don't bottle your emotions. If you want to cry, cry. If you want to blame yourself, blame yourself. If you want to be in denial, be in denial. If you want to go depressed, go depressed. There is a phase. All those stages of grief will come and you will bounce back. If you notice it's taking you a lot of time to recover from this loss, like it's expected that within 3 months of having miscarriage, your emotions might not be 100%, but you would have bounced back. But if you discover that after 3 months, you are still deeply depressed, then at that point, you might have clinical depression. You might go for review and consultation so we can treat you appropriately. Everything about your health must be intact for you to have a chance of becoming pregnant in the future. Your general health must be fully checked. Your emotional health must be fully checked. Your mental health must be fully checked. Your spiritual health must be fully checked before you are ready. Miscarriage, stillbirth, pregnancy loss can affect people differently. Your own recovery is tailored for you alone. Okay, so that's my presentation quickly. And I'm going to open the clinic now, and you have an opportunity to ask your questions. So please start asking your questions. Immediately after this clinic, I'm going to go back to Facebook for another repeat clinic for the same topic. So join me in my Facebook page immediately after this particular clinic. But right now, feel free and ask your questions. Okay, now all questions regarding your lab reports, I'm going to give you a generic feedback. It's not ethical to go sharing your medical reports publicly. Now, the lady that shared her prolactin level at 110, now I don't know the range they use. So normally, if your provider wants you to run any test, if you come to the clinic and I tell you, hey, go and do your blood work, when I tell you to do blood work, when the report comes back, send it back to me. So take that report back to the doctor that requested for the prolactin. But I'm going to tell you this generally. Anytime your prolactin level is high, higher than expected, it will affect the other reproductive hormones. The hallmark of high prolactin, which we call hyperprolactinemia, is the fact that some women will experience what we call galactorrhea. You are not pregnant. You are not breastfeeding, but your breast milk is leaking. That's a sign you might have a problem with your prolactin. Now, some women might experience this, and their prolactin level is within normal range. Thankfully, there are medications we can give you to correct this. Now, high prolactin level can lead to infertility. Thankfully, it's a temporal infertility because when we correct that, then your prolactin level will come back to normal and you can have an opportunity to ovulate. So the problem with high prolactin is the fact that it will affect the other hormones that will help you to ovulate. And if you can't ovulate, you cannot become pregnant. Okay? All right, keep asking your questions, please. This is your opportunity to get feedback from me. Now, remember, on the 29th of January, that's our very first event in 2023, we have our first masterclass. You don't want to miss this masterclass for anything. That's the role goal defining masterclass for 2023. Because in this 2023, we have 4 batches of SGHS babies, fresh 2023 babies. The first batch will be in September. The second batch will be in October. The third batch will be in November. And the last batch will be in December. The first batch coming in September is because it takes an average of 42 weeks, approximately 9 months, for pregnancy to be carried to full term and you will have your baby. So the first phase of women that will become pregnant in our group in this January, they will have their babies in September. The second group will have their babies in October. The third group will have their babies in November. And the last group will have their babies in December. I want you to be among the 4 batches. Whichever one that favor you, just make sure you break the backbone of infertility in 2023. And we can help you. I can help you. I can help you to become pregnant. I can help you to walk you through until you have your baby in your hands. But I cannot help you if you don't want to be helped. So if you desire to be helped, get a subscription. You can come in for 1 week, 1 month, 3 months, 6 months. And if you're currently pregnant, why not? Let's walk that walk with you until you have your baby in your hands. Okay? All right. Keep asking your questions. Okay. Apart from chromosomal abnormalities, what can cause missed abortion? Well, most times, matter of fact, the major reason why you will have missed abortion is actually chromosomal. That's actually the biggest player there. But there are other factors that can lead to miscarriage or stillbirth. Infection, some structural problems, some big gynecological issues like some big fibroids. Some big fibroids can also lead to miscarriage. I've already mentioned infection, some structural problems, trauma. So if you're in a toxic relationship and your partner, abuses you, hits you anywhere in your pelvic region, definitely you can have loss of your pregnancy. But based on missed abortion, the biggest player there is chromosomal abnormality. The biggest player in missed abortion, molar pregnancy, anaembryonic pregnancy, which is blighted ovum, chemical pregnancies are mainly chromosomal. And unfortunately, there is nothing anybody can do about chromosomal abnormalities. It's going to happen. It's going to happen. Okay? All right. Is there natural food that can stop recurring miscarriages? Not directly. There is no direct food that once you take it, you will stop having miscarriages. But of course, you have to eat properly. You have to eat very well balanced food for you to have a good opportunity, even before pregnancy and your pregnancy. Okay? All right. What do I need to do differently after taking all the steps? Absolutely nothing. You just have to, be in a good place, spiritually, emotionally, psychologically, and you go again when we give you a road to pass. You don't need to do anything specifically to, just make sure you're fully recovered. Make sure you will remove all the contents of your baby from your womb, then recover and you go again. Most women will continue to have their babies perfectly okay. Okay, so the fact you've had miscarriage or stillbirth doesn't mean you can't have your babies in the future. It simply means we need to be more careful. So a couple of things. Once you're pregnant, you have to confirm your pregnancy, do blood tests, do ultrasound, then start your ANC immediately. Now, as a rule of thumb, if you had a very challenging pregnancy, so what I mean by challenging pregnancies, there are some women that once they become pregnant, they have excessive vomiting, bleeding here and there. Once you become pregnant, there are 3 things you must suspend immediately: lovemaking, sports, and stress, because the 3 S's can aggravate or make an already bad situation worse. Okay? All right. I'm located in Florida, in US. Since December, Facebook didn't allow you to send stars. Oh, Tosi, really? My dear, I don't know. Facebook is very complex. Because I was wondering, yesterday we had a star party, like real star party. I didn't see you there. It was amazing. So I wouldn't know, my dear. But we know you always care. So don't worry about it. Hopefully you try again and you succeed. How do you contact me? You get a subscription. So if you join our Facebook, admin is going to share the links on how you can contact me. But remember, you have to be resident in Nigeria. For you to be able to benefit from my consultation, you have to live in Nigeria to get help. It's our operational policy. The same thing is applicable to you on X, Christy. So you have to live in Nigeria, then you get a package. And once you get your package, they will connect you to me, then I can set you up. Okay? Guys, we still have 10 minutes. We have a lot of time, so keep asking your questions. Okay, in blighted ovum, unfortunately, you were pregnant, but it was an abnormal pregnancy because there is no evidence of pregnancy when we went for ultrasound. You have an empty womb, empty. There is no gestational sac. Gestational sac and gestational pole are the evidence that you are actually pregnant. So in blighted ovum or anembryonic pregnancy, completely empty sac, there is no gestational sac. So that's what happens. And this type can also be caused by chromosomal abnormality. Okay. All right, guys, keep asking your questions. If we don't have any other question, then I'm going to end the clinic early because can you take Clomid anytime? Of course, you can't take Clomid anytime. You cannot take any drug anytime, including your painkillers. You have to go by the books. The only person that should give you drugs to take are your doctors. Clomid is a fertility drug. You don't go messing with Clomid. So do not. If you used to practice that in the past, stop. You're not helping yourself taking Clomid by yourself, okay? Make sure your Clomid is properly recommended by your fertility specialist, a fertility specialist, not just any doctor. Okay? Very important. Can you become pregnant naturally at 47? Yes. But the question is, what's the probability? What's the chance? What's the likelihood? It's limited. Once you get to age 35, your possibility of achieving pregnancy naturally begins to dwindle. Naturally, at age 47, it's either you've gone into menopause or you're getting ready to enter menopause. Possibility of pregnancy is still high, but it depends on your own constitutional factor. But at 47, if you genuinely want to become a mother, then you need to think outside the box. So you need to go and get help. And one of the best helps you can get is to consider going for IVF and possibly IVF with donor eggs. Okay? All right. There is nothing sad about living in Texas, my dear. We have a masterclass on the 29th. If you join that masterclass, and if you show up every day in my clinic, you will have opportunity to get feedbacks. So the fact you don't live in Nigeria doesn't mean your own has come to an end. No, there are still so many things you can benefit from the group. I practically run clinics every day. So any day you show up, you will leverage on that opportunity. The reason why we limited our services in Nigeria is because the setup of this group was to subserve people in Nigeria. So the setup was to, attend to people in Nigeria, consult them, then get them set up, refer them back to providers back home. That's the original intention of the group, legally. So we keep by the books. So it's not like I don't want to consult you guys, but we are keeping exactly by the books based on the way the organization was set up. Okay? Why do some women experience pain during their menses? That's the natural setup because what happens during your menses? So normally, the body of a woman is structured for pregnancy every month. If you were to have availability of sperm, every month you will become pregnant. That's the original design. Okay, now what happens? When a woman releases her eggs from the ovaries, you can see all this stuff, they're actually the eggs inside your ovaries. They will enter through here. This is part of the tubes. This end has some finger-like projections, which we call, I'm not gonna bother you about the medical stuff. So the eggs will enter here and somewhere wait for the sperm, which will come in through here. When the sperm meets the egg in a special place called the ampulla, fertilization will occur. Now, these are all under the control of hormones, reproductive hormones, estrogen, progesterone, FSH, LH, prolactin, thyroid hormones. Now, as this whole process is ongoing, there will be changes in the cover of the womb, which is called the endometrium. The same hormones I mentioned will start preparing the cover of the womb, especially progesterone and estrogen, to be thick enough so that once pregnancy has happened, the product of the eggs and the sperm will give you an embryo. It's expected that once fertilization occurs in the tube, they will come back and start developing in the womb. That's the process called implantation. Now, if everything happens accordingly, egg is released, sperm comes in, fertilization happens, implantation happens, pregnancy will start. Once pregnancy starts, no longer bleeding. Now, unfortunately or fortunately, if within that time frame in reproductive women, if pregnancy did not happen, but you've already prepared the cover of your womb to accept a pregnant baby that will develop there, if that doesn't happen, the cover of your womb will disintegrate. So pretty much your bleeding every month is like the womb is weeping. The womb is mourning that the pregnancy that you was getting ready to receive didn't happen. So the cover of your womb will break off, it will slot up, and it will be passed out as part of your bleeding. Now, the contents inside that process of passing out the cover of your womb, sometimes some women will have higher level of what we call prostaglandin, which will elicit pain. People have different pathways of pain. People handle pain differently. There are some women that have very high threshold for pain, and there are some women that have very low threshold of pain. So your pain is based on your constitutional factors. Okay? All right. Okay. So do we have any other question? Okay. Now, naturally, someone is asking about low sperm count naturally. Lifestyle modification. And it's the best and the most important treatment of low sperm count. So your partner must stay active. Your partner must engage in physical activity. Your partner must watch his body weight. Your partner must eat right. Your partner must avoid stress. Your partner must immediately stop smoking and immediately stop drinking alcohol and soda. If your partner can do all this, the sperm will bounce back to normal. Okay? All right. So guys, I've come to the end of the clinic today. Remember, my clinics are every Saturdays about this time, 12 p.m. Eastern Time US, 6 p.m. Nigerian time. Then on Tuesdays, it's 6 p.m., 6:30 p.m. Eastern Time in the evening. Unfortunately, for people in Nigeria, it will be your early morning. But if you can't participate in real time, always check out the videos much later. But thank you so much for coming this afternoon. I truly appreciate you guys. Now, I want you to join me in Facebook, in our Facebook group and page, where I will continue the conversation. Until I see you, God bless you and thank you for coming. Bye-bye for now.